Alzheimer's disease not only presents our nation with an enormous healthcare and fiscal challenge, but also takes a tremendous toll on every family that's forced to confront it. I know this at a deeply personal level, as my mother suffered with Alzheimer's for 18 years before it claimed her life. And during the early years of her diagnosis, there were many days that Mom seemed just fine. But year after year, those good days became fewer and far between. It was a long and heartbreaking goodbye to the strongest woman I've ever known. And I know the pain that my family felt is the same pain felt by families of more than 180,000 New Jerseyans battling Alzheimer's today and millions more of Americans nationwide. I know about the intergenerational challenges that confront people caring for their ailing parents and grandparents, as Dr. Karlawish was talking about. My sister was a legal secretary, and I was down here in Washington, so our choice, because of cultural preferences, was to keep Mom at home. And so that meant her having to largely give up her job and me trying to supplement the income. At the same time, she was getting her son through medical school, and I was getting my two kids through college. These intergenerational challenges of taking care of a loved one in the twilight of their life and being able to have the resources to prepare for your children. I know the extraordinary physical and emotional demands placed on caregivers and the vital role that federal programs like Medicare and Medicaid play in patients' lives. So whether it's investing in life-saving medical research or protecting the rights of patients diagnosed with early onset Alzheimer's, or defending the Medicaid coverage relied on by 1 in 4 seniors with dementia, I believe we have to pursue every strategy we can to improve the lives of patients with Alzheimer's and help their families cope with the demands of their care. To that end, I'd like to ask you, Dr. Karlawish, do you believe that we have the clinical workforce needed to ensure the treatment of the growing number of Americans, that they will receive the best care with the most recent advances, regardless of where they live?
I don't.
That's what I thought the answer is, and that is just one of the dimensions of this challenge that we need to address. Let me ask you also, Latinos are more than 1.5 times more likely to develop Alzheimer's as their white counterparts. African Americans are twice as likely to develop the disease as their non-Hispanic white counterparts are. Are there any current schools of thought why these groups have higher rates than others?
Yes, there's two at least. One is, in America particularly, race tracks social and economic access. Individuals who have a life of struggle, socioeconomic struggle, even poverty, until they reach the social insurance program of Medicare, they have had patchy health care up until that. So, for example, undiagnosed or only partially treated heart disease. And so, as a result, are at greater risk of developing dementia later on in life because of having a less healthy brain, which was outlined by your colleague, of the many things that you can do to maintain your brain. So, for example, blood pressure control, well, that requires diagnosis and treatment, oftentimes from about the age of 40 or 50 on. So people of color in America, to the extent that poverty often tracks in America race, have not enjoyed access to health care so consistently. And the second is access to quality education. As your colleague mentioned, there's good data that quality education reduces the risk of developing Alzheimer's disease. That probably relates to two things. Number one is creation of brain reserve. There's a neuroscience theory behind that I think is robust. But also education gives you access to social and economic stability. Mm-hmm. And so I think that the legacy of race in America in social, economic, and impact on individuals is one reason why individuals of Latina and people of color face the greater risks of developing Alzheimer's.
That's why it's important to increase our minority participation in clinical trials.
Absolutely.
To get a better sense. Finally, if I may, I was sitting with Senator Romney, who he and his wife fund a neurological center in Harvard, have sort of like 400 scientists. He told me that you can get a brain scan and the doctors can look at your brain scan and tell you whether 10 years hence you may very well possibly be subject to Alzheimer's. And the reason that that's important is because there are some trials going on where there is some type of spray or other inoculation that could act as a somewhat of a immunization. Are you familiar with that work?
Very much so. I've been part of it as a researcher, and the Penn Memory Center participates in several of those studies. In brief, we've made tremendous advances in our understanding of Alzheimer's disease since 1976, when Dr. Katzman said it's time to stop referring to senility as senility and recognize it for what it is, which is Alzheimer's disease. In just 40 years, at the same time that cancer and cardiovascular disease were very well recognized in 1976, think about that. This disease was essentially unrecognized. In just 40 years, we've made tremendous progress transforming the way we understand this disease. When I started practice at the Penn Memory Center in 1997, you had to be demented in order to be diagnosed with Alzheimer's disease. It was a Gothic horror story because you had to die to get a brain autopsy to then show that, in fact, what caused your dementia was Alzheimer's disease. Now we can visualize the pathologies of Alzheimer's disease using neuroimaging, the scans that Senator Romney was talking about, in a living person. We can visualize amyloid protein, the pathologic protein, in a living person's brain using imaging, and we've developed techniques to visualize tau protein as well. The vision we have in the field, imagine getting tests that show the presence of these proteins and other tests as well that shows evidence of neurodegeneration, and therefore, before you're disabled, starting treatment to slow down the process of neurodegeneration leading to the kinds of problems that your family dealt with, for example. That's the vision that we have, similar to the vision of you turn 50 and you get a cholesterol test, and based on that result, you start a therapy. Or you get a bone mineral density, and based on that result, you start a therapy. That is a vision, and I have to say, again, 1997, that was unknown to us. And now, less than about 20 years, look at the progress we've made. And I want to thank you all, because that's because of the funding that you all began to do when you doubled the NIH budget, and then when you passed the Alzheimer's Accountability Act and increased the funding available for Alzheimer's disease. That is an incredibly short period of time of progress that we've made. Incredibly short period of time.